Right, good morning, everyone. We will go ahead and get started. Thank you all for joining today's CPI quarterly informational session. Can someone please confirm you're able to see my screen?
Yes.
Thank you. And just for everyone's awareness, this meeting is being recorded just for the purpose of taking notes, especially if we have anything to come out of our Q&A session at the end. The purpose of these meetings is to update everyone, interested stakeholders, on what we've been doing for the last few months. In continuous program improvement with the DCH. We had our CPI steering committee meeting at the end of June, and so this is also an opportunity to provide some information that may have come out of the steering committee to the larger CPI group. So in all presentations, we just have the vision, mission, purpose here just listed so it stays at the forefront. But I'll spend most of today's discussion talking about our actual initiatives and kind of next steps. This slide here just lists out our development life cycle, listing out solicitation, which is just the process that we've been using for CPI for people to submit in potential ideas for improvement. Clarification, which is the process we use once we get into the actual work groups to talk through some of those ideas, make certain that everyone understands what the problem is, and then we start looking at potential solutions to solve those problems in feasibility analysis. Then into prioritization, which is where we, look at solutions and make determinations on which may be the best ones to move forward with. This is also the point in time where we would bring in the CPI steering committee to help make some decisions on what the priorities are. Presentation, that's what we're doing here now today, informing stakeholders on decisions that have been made, or providing updates just on where we are for certain projects, and then moving forward with implementation. So this slide here for our CPI initiatives, this is what was presented back in March. At the time, we had 18 initiatives. Each of those initiatives sit at one place within the life cycle, depending on where we are. I did change this up a little bit for the presentation for this month and moving forward to only look at our active initiatives. So we're actually going from 18 to right now 13 active initiatives. And part of that is because we've had 3 initiatives of the 18 that have now been completed. And we have 2 of those initiatives, as you see over on the right-hand side in the completed section, they've been stricken out. Those were canceled mainly because they were identified to actually not be an actual issue. So they're listed here, and again, we have 13 active initiatives. I'll start over in the completed section and talk through those, and then we'll make our way back to the start with solicitation. But the 3 items that we've moved to completion over these last 3 months is the TMSIS audit process. And basically what this means is that we look to create an internal process at DCH to ensure that as items came out of our TMSIS audit process, which is work that we have to do with the feds, we have to submit claims and encounter information for our fee-for-service and CMO populations. Through that TMSIS process, sometimes we receive information back from CMS indicating that to comply with their standards, we have to make changes. And sometimes those changes have an effect on the way that our providers submit their claims. And so we wanted to set up a process internally to ensure that as we learn about items on the TMSIS audit, that we incorporate our external stakeholders and get their feedback before we engage or before we move forward and asking the CMOs to make some of these changes. So we've implemented that process, and we've actually used it in these last month or so with an issue related to dental claims and anesthesia codes that are currently billed on dental claims that need to be billed on the 1500. Through that process, we initially thought that there were not going to be any issues with moving forward with that. However, just as soon as on Friday, we learned that there may be an added administrative burden. And so through that process, again, we've been able to collect that information from the stakeholders, and we'll be having more discussion internally as well as with the CMOs to better understand how we can move forward with that particular item. But again, it's moved to complete because the actual initiative was to establish the process. And so we've established that process. The next one is the OPB annual performance measure process. This one is is in green, which indicates it's an internal CPI initiative. And so not many stakeholders are aware of this one. However, it is something that CPI is doing. It provides an opportunity for us to look at key performance measures, key performance indicators throughout the department to ensure that we are kind of meeting the needs from our Office of Planning and Budget. We automated that process, and that automated process was completed last month. The next item is the uniform formulary. This was out of a request from the prior authorization work group to look at either in total looking at our PDLs or for particular drug classes to uniform it across all the CMOs and fee-for-service. This one has moved to completed because the department dispositioned this particular item, and that disposition was provided to the PA stakeholders, all CPI stakeholders, which just indicated that at this time, DCH will not pursue a uniform formulary and will not engage the discussions until we start with our CMO reprocurement. So again, this is moving to completed because it's kind of a closeout of some of the discussions that have happened over the last probably couple of years in CPI on the PA work group. It's closing it out from that standpoint with the understanding that once we engage and start research on what our new agreements will be with our CMOs through our reprocurement, we will engage our stakeholders and begin to have those discussions along with the consultants that we will be working with to construct that RFP. And then again, the other two that are in the completed section, those are crossed out, those were canceled. So going back over to the left under solicitation, we have the dental fee schedules. This is something that came out of the Georgia Dental Association. It's still in solicitation. It's for the claims and billing work group. We have a couple of items already that we've been talking through in the claims and billing work group. And so that's why this one is still sitting in solicitation, and we'll pick it up later this fall once we get some resolution on some of the current items. In clarification, we have the SDOH data collection, which is also on pause because the healthcare accessibility work group, most of those efforts have been placed on the Lifeline project, which I'll talk about in just a little bit. So that one is still in clarification. And then we have the multiple provider processes. This one is stays in clarification because we're still waiting on some information from the external stakeholder community so we can begin discussing what type of provider processes are we referencing here. So we need more information before we're able to move forward on that. Under feasibility analysis, which is where most of our items are, our work groups are still having discussions about these items and, gathering data and still figuring out how to best tackle some of these issues. On the encounter data quality, that is an internal initiative, but something definitely the CMOs should be aware of. We are interested in improving the quality of encounter data. This is something that CPI is working on internally with our performance quality and outcomes group with Carla and Dr. Holloway. The next two items, COB policy and ER payment policies, these are also with the claims and billing work group. And again, still working with our external stakeholders to gather more information to be able to go to the CMOs and really come up with some solutions. We have data. We've been looking at a lot of data, but haven't come to the right type of information to be able to have a discussion which really pushes this one along. The next four are related to Provider, leveraging the group MPI, the updated search functionality. Both of those are specifically related to our Provider services module implementation. The vendor we are working with is CNSI, and out of the work over the last 3 months from the Provider group came pain points that related to wanting to leverage group MPI through our provider enrollment process, as well as creating a more up-to-date and easier to use provider search functionality through our provider module. So those items have been given to CNSI. We have weekly meetings with CNSI, our provider work group team, with representation from that vendor, where we talk through a lot of the pain points. We talk through data mapping issues. And so as we come to solutions that DCH approves, then that information will be communicated out to you, and these items will be moved into implementation. The other item that we are working on in the provider work group is related to provider timely loads. Right now, the focus is on the delegated roster, and so we've received a lot of information from some of our large health systems on ways to improve the collection of information from them. This is information that goes to the CMOs so that they can ensure they have the right information to be able to load data on their sides. And so we are continuously working on this. Had a productive meeting last week where we made updates or some decisions about how that roster may be changed to benefit those delegated providers. And we also have some questions that we have to send back to them just to get more information. So we're moving forward on those. The last two items under feasibility are from the prior authorization work group, the Unified PA portal. This one is in bold because it was discussed at the CPI steering committee meeting, just to make certain that everyone is on board with us moving forward in looking at extending the services under behavioral health to the Unified PA portal. Right now, we have outpatient behavioral health services and autism. And so now we are looking to expand that out to other behavioral health services, inpatient facility, PRTF. And so we've started those discussions last month, had a good discussion about that, and have requested some information from the CMOs, and are also looking at, crosswalks for behavioral health PA services across the CMOs to move forward with this. And taking some of that information to Alliant so we can get feedback from them on how we could potentially implement some of those changes. And then the last one there is eliminate radiology PAs. This one is on hold as we work on the Unified PA portal. Though we have made some requests from the CMOs to get information about the process they use when determining when they may remove a particular service from PAs. So we'll leverage that information in the future. And then lastly, implementation. The one item that we've pretty much are moving full steam ahead on is the Lifeline project. This is a relationship that that DCH has built with PulseWorks and American Broadband to bring free cell phone services and free cell phones and services, which include a hotspot to Medicaid members. The goal is to institutionalize the process, and for all entities that have direct contacts with Medicaid members, provide training so that we can, number one, in part of our interaction with our Medicaid members, let them know about the project, and if needed, assist them with getting enrolled in the program. So again, we started that officially on July 1st. We have had trainings with EVB. We had training with our healthcare accessibility work group, and also extended some of that training out to DECAL and DOE, several other organizations who have touch points with our members in different ways. And so we will, over the next few months, continue to have those trainings using PulseWorks and continue to move forward with that. Once we get to a place where we truly feel that we're penetrating the Medicaid membership and seeing increases in those numbers, we'll kind of shift focus in the healthcare accessibility work group and start looking back at our social determinants of health. So that is kind of the overview of where we are with our CPI initiatives. So what is next for us? I have TBDs for all of the upcoming work group meetings for a couple of different reasons, depending on the work group. The healthcare accessibility work group and provider work groups have already met this month. We typically meet on a monthly basis. I have TBD for those because next month in August, when those meetings are scheduled to be held, I will not be in the office. And so what will probably happen on the healthcare accessibility side, again, we're continuing to have the Lifeline trainings. And so that meeting will probably be canceled because the work will be done in the other training meetings that we have. On the provider side, I'll probably cancel that meeting. However, we'll be reaching out to the specific people on the CMOs, as well as our kind of the contact on the external stakeholder side, that's SPOTO, and probably we'll have just a smaller meeting at a different time to talk about next steps as we receive some of the other input from our CMOs on the types of changes they can make to the delegated roster. For claims and billing and prior authorization, those meetings are scheduled to happen this week. However, on the claims and billing side, we have not captured enough information, I believe, to have a full discussion. I have not yet canceled the meeting because I'm still looking through some of the data we have, but it is possible that meeting may get canceled because there's not really enough to move forward with on a discussion. The prior authorization is TBD, even though I do believe we have at least one agenda item in talking with Alliant. And so it's that meeting will probably stay on the calendar. But again, I put it TBD because it's possible that one may not happen this week. Again, just want to use everybody's time wisely. And so if we don't have all the information we need to have the discussion, I prefer to cancel it until we do have the meeting. For our upcoming steering committee meeting, the next one is September 28th. And then our next quarterly informational meeting will occur on Monday, October 4th. As always, we have the request, if you have any sort of ideas or thoughts about things that you think CPI can help with in removing administrative burdens, use the solicitation form. You can click on the link there once you receive this presentation. So that is all I have to report on today, opening the floor for anyone who may have any questions. All right. Hearing none, thank you again for your time. I really appreciate it. I will again send out this presentation at the conclusion of this meeting. Again, if anytime you have questions or comments about any of the work on CPI, feel free to reach out to me and let me know, and we can talk about it. And yes, Christy, I can send out the recording as well. All right. Thank you, guys. I appreciate it. Have a wonderful rest of your day. Thank you.